Hello, students. This lecture will be on Chapter 33, which is Delivering Dental Care. Chapter 33 could be found in your Modern Dental Assisting Textbook, edition 13, on page 460. Of all the learning outcomes that we would like or that are listed on page 460, we do want to know about the key terms. We definitely want to discuss and review patient records. We want to discuss concepts of team dentistry and the operators and assisting positioning. We want to define operating zones and describe the transferring of the instruments and their grasp. And definitely we want to discuss the expanded functions. Overall, we want to know our patients. We always want to get ready for the day. Sometimes that could be followed up with a brief meeting or a review of the day's schedule, like a morning huddle, which helps people to prepare. And when you're prepared, naturally, the day runs smoothly so that there's no surprises. We always want to discuss the change in schedule during these meetings or during these huddles, or if there's a glitch in the schedule or a glitch in the procedure that we anticipate to do on a certain patient. Let's say, for example, a crown didn't arrive in time, or a partial denture didn't arrive from the lab in time, and Miss Smith or that patient is coming in that day. So we would have a problem in the schedule, or maybe something didn't fit last time and this time it should fit. So again, we want to avoid any type of surprises or mishaps. We also want to talk about the fact that there could be changes in patients' health, and that could alter the dental treatment, even up to the point where there could be a cancellation. Like if Miss Smith did not, for example, pre-medicate, if she didn't take antibiotics or something that she was supposed to take right before coming to the dental appointment, that could result in an actual reschedule, or we would have to cancel that appointment. Additional supplies or equipment that may be needed. Like, let's say this patient is coming in, we're going to need, I don't know, some sort of laser machine in addition to the other stuff that is scheduled. Also preparation for an apprehensive patient. Let's say Jimmy, for example, a pediatric patient. Jimmy's coming in, he's really scared. Let's make this flow nicely. Or let's say it's a first timer that's coming in and the mom said that, my kid is always scared. So we want to make sure things run smoothly for that. And of course, we want to make sure that we all know our expanded function duties. When you're reviewing the patient record, there's several sections that have to be considered, and they're reviewed at each patient visit. I think we went over this in DNA 113, where I said you always have to ask the patient, has there been any changes in your health? Well, that's when they come to the back. But in the front, where the front desk is, on an administrative level, they ask for changes in insurance, address, phone number. And I think all of you, when you go see your doctors or at your doctor's office, they always ask, has there been any changes in your address? Or I don't know, in your information or your insurance, etc. And then when they go in the back, there's medical alerts that we have to really consider that can also alter the dental treatment in the back. Okay. And then, of course, we make note of this in the progress notes, whether you have written charts, like you have to write it in, or whether they are electronic charts, we have to type them in and you have to write what the changes are. Again, this is all these are all legal documents. So it's really important that we consider those things. Overall, we always want to prepare for the treatment area. We want to look at the treatment room, make sure it's clean, disinfected, and that it's ready for the patient. We want to make sure that the radiographs are there. And we spoke about lab cases, for example, crowns, even Invisalign cases, or even bleaching trays. You want to make sure they are good to go and they're in the room when the patient arrives or even before the patient arrives. We want, of course, their equipment. We want to make sure their tray is, their sterile preset tray is there. The chair positioning with the armrest is up. And of course, the entryway for them to enter the operatory is clear of any unnecessary treatment, because the last thing we want to have is you running around trying to get, certain equipment ready, or that the patient trip on their way into the dental chair. We want to make sure the area is clear. You do have some, I think what we call purple pages in chapter 33. I'm looking at it right now. You do have some purple pages, so it's important that you review procedure 33-1. I think we already went over this in DNA 113. So you pleasantly want to greet the patient. I'm just going to go over this a little bit more quickly because, this is just a reiteration of chapter 33. You want to escort the patient to the treatment area, put their belongings in a safe place, initiate conversation. Silence is kind of dangerous, especially when it's a child. You want to make sure you strike conversation. And also, while you're doing that, ask whether the patient has any questions about the treatment that is about to be done. Okay. We already talked about raising the arm seat, making sure the chair is at a proper height, place the napkin on the patient, inform the patient about adjusting the chair before you do it, okay? Because a lot of people get kind of startled, position the operator light, complete the treatment room preparations. And then, of course, when your doctor's ready, wash your hands and then put on your PPE. Based on the concept that the dentist and assistant work together ergonomically, we have something called team dentistry. And the main purpose of team dentistry or four-handed dentistry is we want to reduce the fatigue. We want to reduce the stress that goes on in dental procedures. Remember, in the end of the day, we're a team. We want to reduce the fatigue and get more productivity out of it. Okay. So again, the concept of team dentistry, how do we approach it and how do we prepare for it? We want to decrease the number of instruments, know the sequencing. We want the correct positioning of the patient, dentist, the assistant. We don't want to go scrambling around for things. And then we want to have proper performance of the expanded functions that we know about. Okay. Definitely, of course, those functions that are delegated by the state in which you're practicing. And again, the goal is deliver the best and most effective care to patients and increase their productivity. This eliminates 92% of non-invasive movements and increase productivity by 100%. Okay. And of course, we want to reduce the stress on the body. We want less reaching. Remember, we talked about class movements. The higher the class grade, the bigger involvement of the body in the movement. So we always want to do our best. Obviously, ideal is class 1 movement. We want just fingers, but of course, we have to deviate, use our wrists. We want to avoid moving the actual torso, the twisting. We want to avoid those issues so that you don't have problems later. Always lower the patient to the supine position when they're ready. And again, ask them to slide up to the chair if needed, adjust the headrest. Okay. And then ask the patient to turn his or her face to the operator to allow easier access, or even to you sometimes for certain procedures. And the correct distance should be, for your working distance, should be 12 to 14 inches from the patient's face and the operator's face. So think of a ruler, a standard stick ruler that they sell. Just picture the length of that. So from, your face, or rather the operator's face, to the patient should be around that, if not 1 or 2 inches more. Okay, and this is standard. You see this picture here. This is in your textbook. This is a standard, like 12 inches away from, from the patient's face. Okay. This is the proper way to sit. You see the backrest for an operator. And again, the thighs should be parallel to the floor. The feet should be flat on the floor, and you should engage the lower back on the backrest of the operator chair. And then, of course, a straight posture is what is recommended. For the dental assistant, really, if you have a backrest, it'd be great for you to engage with that, with your lower back. If not, you have to keep a straight posture and definitely use that elbow rest. You always want that elbow rest, okay? And then your feet go on the footstool, okay? Your feet go on the footstool. If they're going on the floor, you have to position the assistant chair properly, so that you could be comfortable. And again, the eye level from you to the operator is 4 to 6 inches. Eye level 4 to 6 inches above the eye level of the operator. Okay. So look at the dentist and see their eye level, and then you should be half a ruler above that. Overall, the dental assistant should be above everything. We went over a little bit of the class movements. Remember, class 1, we want the smaller number classes that we use in terms of movements for you guys. Class 2 movement is just the fingers and wrists. And as we go up, we definitely want to avoid class 5 movements. But if you have to use it, you have to use it. We want to use it as less as possible with those bigger numbers. Remember the wonderful clock that we use for the operating zone that could be found on page 463 of your textbook? So the operating zone, you have your operator zone, you have your transfer zone, assistance zone, and no man's land, like the static zone, okay, which is behind the patient. So do recognize that for a left-handed operator and a right-handed operator, okay? These are the two pictures that you have in your textbook. And then, of course, we do have instrument transfer. We talked about this, we want less fatigue, less stress, and more productivity. And, we want you to be able to really utilize the proper way so that, you can, you can enjoy the procedure or be less fatigued. Okay. I believe we had single-handed transfer and we had double-handed transfer. And here you have grasping the instrument, and depending on the instrument, this is how you will grasp it. You got the pen grasp, and then you got the palm grasp here, and then you have your palm thumb grasp, just like how you cut an apple. So these are things that to also consider depending on the instrument. Okay. Um, Again, you want to transfer dental instruments and materials with your left hand. Okay. When it comes to the suction, we want to hold that with our right hand, even though it's instinctive to hold it with our left because the pipe is closer to the unit. But that's not the case. The case would be you want to transfer dental instruments with your left hand. Okay. There was also single-handed, which is pretty easy, but double-handed is something you have to kind of use using all four fingers of that one hand, of your left hand. With a single-handed technique, you see the person here in this picture. It's a little blurry, but you see them receiving with their pinky and giving with the two fingers, which would be their index finger and middle finger. And the same goes here. They're actually giving it with their index finger and their middle finger and thumb. They hand it over after they retrieved it with their pinky. Okay. And remember, when you first start the patient, you want to use two hands when you're providing a mirror and an explorer when the patient is first being seen. Okay, there are variations in the instrument transfer. Okay, like handpiece is more heftier. Instruments with hinges would be a little bit different. So you want to consider that. Okay, mirror and explorers handed the right way. You want to put your mirror in your right hand, okay, and the explorer in your left. Always picture yourself sitting here. Okay? So the cotton pliers, you want to make sure they are engaged, use a firm grip, because if it has a cotton roll in it, which most likely it does when you're transferring it, the operator will then hold a firm grip to grab it back from you to engage it. Handpiece, this is how you hand over the handpiece. The working end is towards you. So instrument with hinges, you will hold on to the working end. For example, here is the hemostat, so that the operator can immediately engage into the two holes of, for example, this hemostat or scissors you have here. Expanded function, we definitely want to utilize expanded function as it is designated by the Dental Practice Act of the state of which you are practicing. You want to have increased productivity, less stress on the dentist and you. More patients are seen and better job satisfaction. And overall, there's different types of supervision as dictated by the DPA. You have direct and indirect supervision, and direct supervision is when the dentist is in the same treatment area, and indirect supervision is when they're not necessarily present in the exact same treatment area. Okay, so with the expanded functions and you're working as an operator, let's say you're working as an operator, there's certain skills you have to utilize when it comes to the vision or using your mirror. You could use indirect vision. You want to establish your working position, and you want to establish your preferred mirror to tooth position and use a fulcrum. So fulcrum is always that finger rest, because if you don't use a finger rest, your finger will constantly shake. So you have to kind of find an area where you can provide yourself with a finger rest. Okay. And you want to understand dental anatomy overall. You want to know how the patient bites. You want to know the contours of the teeth, the surfaces. You want to know cavity preparations. Like if you remember from DNA113, there was class 1, 2, 3, where class 1 cavity preparations were just occlusions, occlusals, just the tops of the teeth. And then you had class 2 and class 3 and all that. So in those cases, you would use matrix bands or wedges. Okay. All right, and then of course you want to think about adapting the instrumentation, applying dental materials, and you want to evaluate expanded functions. Okay, this is your indirect vision right here, and this is an example of utilizing the fulcrum to stabilize your hand. Utilizing the mouth mirror, you can use the mouth mirror for several functions, even to retract or push buccal mucosa aside so you can see it better. You can even use it when it comes to the light, so that the light can illuminate, the mirror can illuminate light onto the tooth surface, and you can use it for indirect vision. So for a better understanding, I need you to please make sure you review these purple pages, which is at the end of chapter 33. Okay, and then yeah, so chapter 33, you really want to make sure that you look at those purple pages because it really explains things in depth. Okay, thank you.